Home health aides and direct care workers keep millions of Americans safe, healthy, and independent. But do our current policies and practices acknowledge their critical role in our society? Fortunately, these conversations are increasingly coming to the forefront as our nation's policymakers reckon with an aging American population and an increasing demand for home care. We must address workforce shortages, low wages, and burnout to ensure we have professional caregivers in the field. So what needs to change? How do we recognize and support the people doing this vital work? Let's dig in. So we've talked about how important care at home is, but now I want to zero in on a discipline within the care at home community that is often under-recognized, but is critically important to the care that's delivered to patients and families, and that's home health aides, home care aides, whatever you want to call them, the heart of care at home, if you will. So I think let's start painting a picture with what these home care aides do each and every day in the homes of patients and families that our providers serve.
Elyssa, one of the reasons that I got into care at home and really wanted to focus my career as an advocate is just seeing the impact that the workers have on human health. I went to medical school. I'm a physician by training and cared for patients. And, we've got prescription pads and it can order labs and imaging studies. And there's all this sort of high-tech stuff in medicine. And one of the things that's just striking and humbling, quite frankly, as, we deal with aging and chronic illness, is that really the care, the direct care, the basics that home health aides bring has a greater impact on health and well-being often than any of those sort of, sexy or high-tech medical interventions, right? Time and time again, I've seen with my patients how their lives are improved, their families are stabilized when they get that type of help. And so what are we talking about here, okay? And there's a lot of variability. You mentioned, home health aides and personal care workers and other terms. Actually, states recognize these type of workers differently. So in some states, they might have one terminology, and others another. There's different training levels and certification requirements state by state. There is no real uniform national model. But what we're talking about are often help with the basics of life. So we think about activities of daily living, okay, things like bathing and feeding, like, if somebody's had a stroke or neurological disease and they need help, with feeding themselves even, that might be something that an aide might help with. A lot of that bathing, grooming, dressing, that hands-on personal care for people with serious chronic illness and disabilities is so important. And it's so intimate, you can imagine, right? This is not something that you would just want to trust, a random person to deal with. It's incredibly personal and can be anxiety-provoking, can be painful, depending on a person, can be scary. If let's say somebody has dementia or some other type of neurological issue and they're not understanding these, just the basics of taking a shower can be scary even. And so, then, there are other things that are less hands-on, maybe household tasks, just keeping a house in order, things like meal prep and laundry and other things that are needed to, for somebody to succeed in their home with good hygiene and, other areas, in some cases, transportation and help with shopping and errands and things of that sort, companionship. And that's actually, I think, one of the most overlooked aspects here is just the friendship, the kindness, we have people that are dying literally of loneliness in our country right now in terms of, people that are isolated with serious illness, and aides are there, that they're their companion often, they're their friend. And so I don't even think I'm really doing it justice, but that's the type of stuff that home health aides are doing.
Yeah, absolutely. I know we'll share some stories later about what that can look like, but I know it is absolutely transformative. So let's think about where we are in terms of the numbers and the workforce shortages that we know we're facing. So obviously, we've talked about workforce shortages before. They impact the full care continuum. They impact all disciplines. But I know it can be a particular challenge with home care aides. So what are some of the issues that are being faced right now within the home health and home care community with these workforce shortages? And let's also start to talk about some of the solutions that providers are implementing to help fortify their workforce, whether it's training or other care models or ways that we can help fortify that workforce?
Yeah, listen, the workforce challenges around these type of workers are real severe. If you just go and hop on like a job search engine, pick any town USA and plug in home health aide, in many instances you'll see hundreds, if not thousands, of job openings posted. And then if you go into the broader direct care workforce, CNAs and PCAs that might be working at facilities or hospitals, it's even bigger. And so it is daunting in terms of the numbers. Now, it's a rapidly growing area of the workforce. And, we're seeing jobs added, demand increasing because of the aging population, because of the preference of care at home and people wanting to be at home, people living with serious chronic illness and disabilities longer. And then, the younger population, the caring population, the ages that we typically think of as being aides, that is not growing as fast as the older population. I mean, there are many counties in this country where you're seeing, rapid growth of the older population, be that the 70 plus or the 85 plus population. And in those same counties, like basically flatlining of the number of people in the younger age groups. And that has implications for the job. Now, that said, on top of all this, while I think it's meaningful work, it is work worth doing that is rewarding and I think brings fulfillment to people. It is not that well paid. Okay. Home health aides are on the lower end of the wage scale when we look across different occupations. And so getting people, this takes a really special person to do this. We're talking about people with the biggest hearts, often, living out their faith in their work, because it requires such dedication. I think we've got to figure out ways to get people into this work where they don't just see it as an end, that they're on some type of broader professional journey, that maybe it's a pathway to getting additional credentials and certification. We also have nursing shortages. How do we help home health aides that are interested get supported in training so that they can maybe get nursing certification at some point later in their career? I think it'd be great. I tell medical students and people that want to be medical students, like pre-meds and stuff, I said, if you really want to understand patients and families and your, something to supplement your income while you're going to school, consider becoming a home health aide and work, some weekends or overnight shifts and help out.
Yeah, absolutely. And I've seen those career pathways work. Like I've worked alongside aides that have invested in further education, become an LPN or a nurse at an agency, and then continue to grow to maybe even become a clinical leader in their space. So it absolutely is a pathway to the future. But I know one of the things that we've talked a little bit about providers struggling with is the resources needed to invest back into those training and development programs. And I don't mean to sing the same song and dance, but reimbursement is so important, especially in the home health world, for allowing these programs to take place. Because right now, a lot of providers might not have the resources to further invest in their workforce because they're just trying to make ends meet to get to care for patients and families. And then you also have, in some kind of rural areas, that provider who may be out at the brink of shuttering, they're the only ones providing that training. So even if you wanted to become a home health aide, if that agency closes, well, where do you go to get that education? So have you seen any creative solutions, or how does that land with you?
Yeah, well, first, in terms of the challenge in the reimbursement issues, it's enormous, right? I remember when I was CEO of Visiting Nurse Association Health Group in New Jersey. During my tenure as CEO, the state Medicaid plan that provided Medicaid home and community-based services flipped from a state-managed program over to one that was run by the managed care organizations. And one of the biggest managed care organizations that we were working with was basically capping the rates that they would pay for home health aid services under $15 an hour. So that's what they were going to pay the agency. Okay, so meaning you were going to have to recruit retain people, provide benefits, make sure that that they were supervised and had the right type of support that was needed, and paying a workman's comp, unemployment, social security as an employer, pay a living wage, which you would hope to, and somehow do all that for less than $15 an hour. It's just not humanly possible. And so, we've seen all sorts of challenges that's created. And in terms of the creativity, the things that I love are the providers that have really done a lot with education. Okay, you've seen, programming where the aides are getting support in terms of, advancing their education and their careers. Also, support of, these are often highly vulnerable workers. Okay. Sometimes we're talking about first generation Americans. Okay. Sometimes needing help with language, job skills training, technology training, just to get some of the basic skills that are needed in the workforce in general. So those type of training programs, focusing on their human needs, childcare, making sure that transportation issues are loom large, housing are big issues. I think that's another incredibly interesting topic, is just workforce housing. And some communities have gotten so expensive, and these are aging communities, right? Think of Palm Beach County, Florida. All right. It's an incredibly wealthy county in many respects. It's aging much faster than the rest of the country. The older population is enormous. There's a need for home health aides. Where are they going to live? Where can they afford to live? And so housing issues are big too. So the providers that have sort of developed programming around these areas, everything from education to the social needs of the aides, just basic job skills, that's where I'm excited.
Yeah, absolutely. I think the point you made about supporting those individuals so that they can live their life and balance that with the responsibilities of the workforce is super interesting. I've seen some providers create programs that support childcare for the aides and the other staff that they have in their employment. And I think partnering, like home health and home care agencies, are already pillars of the community. So looking to create partnerships within the community to help support the workforce is super critical. If you have to pay for childcare, but you're only getting paid a certain amount per hour, you're probably spending more on childcare than you are getting paid. And obviously that's not a feasible life. So I think that type of programming is really critical.
Yeah, those partnerships with workforce development organizations, with community colleges, vocational schools, even high schools. That's the other thing. If we're going to address the needs of an aging population, we already talked in another episode about how fast our population is aging. If we're going to address those needs, we're going to have to get into high schools, and maybe even earlier, and introduce people to the idea of working in caring fields. So, that's critically important.
The working with high schoolers and younger is a special passion of mine because I came into the hospice workforce so early. I was in college writing about hospice, and all my friends were like, "Why do you care about this?" And well, because we're all going to have to care someday. And same thing with home health and all of home care. I know there's been some alliance members working on different programs and initiatives, like educational toolkits that they can bring to colleges and universities, even to just introduce the field of interest, because even those students that want to go into the medical field don't think about home-based care as an opportunity or as a pathway to show them not only is this a field that you can get involved in, but also it provides so much autonomy, and it's just a totally different level of fulfillment that you get from care in the home than from other fields. And you can start your pathway in at whatever point you want, but just making sure that's part of the vocabulary when they're thinking about where to go next is really interesting. So if we engage the workforce early, we get people interested and they can start to build a career, and then we've already got systems in place to provide that training. I think it was recent data from the Cleveland Clinic's Office of Patient Experience that showed that training increased patient satisfaction by over 90%, which is a staggering figure to even think about. If it just takes a little bit more investment in training to provide those better outcomes, but you're also investing in your workforce in the process. That's, again, one of those win-win situations.
Yeah, of course. And the training and that, focus on getting people into these careers earlier is critical. And then I want to flip it and just talk about the whole other end of the spectrum, because the numbers are staggering in terms of, the demand because of the population change. We're going to need, I think, a 33% more home health aides over the next decade. And where are they going to come from, right? The population, in those younger caring years, like 18 to 64, they're not growing. Okay, with respect to how fast the older population is growing. So these caregiver ratios are getting compressed. And so where else do we find people? And one of the areas I think is worth talking about a little bit, at least, is older workers. Okay, there are many vibrant, healthy people that would enjoy and find meaning and be great at caregiving. And so, at some point, as we get older, we can't all, if we're fortunate enough to be able to retire, just, go play cards or, go fishing or something. Somebody's got to stay in the workforce, and hopefully older folks that will see that they want something to be involved in, that they want something meaningful. Maybe they need, I've seen some stats on the retirement funds of, the baby boomer generation. Not every one of them has even $1 in those accounts, and some people will need to work. And so, making sure that as employers that we are welcoming and supportive of sort of retirement reimagined. And, we've talked about healthy aging, right? And one of the biggest issues of healthy aging, I would say, is having meaning and purpose. A lot of people, wither and struggle when they don't have that meaning and purpose. And being a caregiver, being a home health aide could potentially provide some of that meaning for some older people that have the physical and, ability and wherewithal to work as a home health aide.
I absolutely love that. And I feel like we're not talking about that as much as we should be. So that's a really fresh perspective to bring. And you went exactly where I wanted to. As soon as you started talking about engaging the older populations, I thought, well, that's the perfect way to continue with that meaning making and to age well themselves. So again, you're investing in yourself as much as the aging population that you're caring for. One more point to touch on before we talk about just a few resources available. I hear a lot about nurse delegation, and I know aides serve as the eyes and the ears of physicians, even in many instances. Can you talk about how aides can help support nurses and physicians in making care coordination plans and serving patients and families?
Yeah. So the interplay between nursing and aides is critically important, right? These are teammates. They work closely together. In most states, nurse supervision is required for aide services. The oversight of aides is part of the nursing profession, and nurses often are the ones doing the training and the certification of aides. And so this dynamic is of critical importance. And we have shortages, by the way, of nurses as well. Dramatic nursing shortages in many areas. So I think it's critical that aides have the ability to contribute as best they can. Now, if we start getting into the details of this, different state laws come into play. There are differences, but ultimately, with close supervision, aides in many instances could take on delegated tasks in a safe fashion. One of the most common issues I think that people have for aging at home is like medication management. And I think we really ought to think about where and how aides can do more to support medication management with appropriate nurse oversight, of course. But listen, family caregivers and individuals with no training or experience are managing their medicines often haphazardly. Having an aide that's appropriately trained with nurse supervision could be a big improvement in safety in many respects.
That's a great point. And you also handed me a transition on a silver platter, because I will shamelessly plug caringinfo.org, as you know, a program of the National Alliance for Care at Home. But it provides free resources and education to consumers, caregivers, and even providers alike about care at the end of life and care upstream of that. We're actually working on a new section right now about care at home that moves further upstream. But it provides simple tools to start conversations, ways that caregivers can speak with their professionals. So when we're talking about those family caregivers, we can help them kind of close some of the gaps and take some of that burden off of them, because as critical as the home care aides and the home care workforce are, they can't do everything. And we know so much of the burden still lives with the family. So there's a lot of work that needs to be done there. But caringinfo.org is a great place to start if you just don't know where to go and you need to get help. In addition to the resources that I spoke about, they also have a full advanced directive library for all 50 states, plus Puerto Rico and DC, available in English and Spanish, and annotated. So if you're like, I don't know where to start, I know I need to get my wishes documented, but this is overwhelming paperwork, no one's here to walk me through it, there's a little note that says, put this here, sign here, so you'll know everything's in order the way you want it to be, and those aides and the rest of the care team can fulfill the wishes that you want for your care. For the next part of our conversation, we're excited to welcome Brandi Kurtyka, CEO of Mission Care Collective and an expert speaker regarding the home care workforce. Brandi leads Mission Care Collective forward by bringing together a team ready to change the culture of care, ultimately striving toward care that is better tomorrow than it is today. The Mission Care Collective umbrella includes MyCNA Jobs, connecting employers with potential employees, Coach Up Care, bringing together teams through a virtual community designed to foster true connectedness, and Mission Care, bringing partners, communities, policymakers, and the care workforce together to create unique programs that accelerate change. Brandi, welcome. We're looking forward to learning more about Mission Care and your broader vision for care at home.
Thanks for having me.
So we're going to dive right in with a tall order, but in your eyes, why don't policymakers prioritize home care workers?
That's an easy one, right? So I think the short answer is it's really complicated. And I think that's part of the problem. So the U.S. has no shortage of competing policy priorities. And I think workforce development is really, really complex. And when I was preparing for this and started to think through, today's podcast, on paper, home care seems like this really obvious investment. So it's more affordable than institutional care, supports aging in place, plays a key role in managing chronic conditions, preventing hospitalizations. But home care workers, you think about who these people are, your caregivers, your CNAs, your home health aides, they're often just like less visible in these policy conversations. And I want to share an interesting stat as I was kind of thinking about this today. From a data standpoint, we all know the data from a demand perspective, right? So the US is going to need like 4.6 million direct care jobs to fill direct care jobs by 2032. And if you take a step back and you look at that and you say, okay, most providers have a 3 to 12% applicant to hire rate. You have turnover that's like increasing, that's 79%. You need something like 30 million plus job applicants between now and 2032. And I say this very humbly, but we manage the largest caregiver network in the nation, and those don't exist. That many, those humans don't exist. So I bring that up because I think still talking about recruitment, many leaders, many policymakers, many providers, they still feel comfortable with this idea that we can recruit our way out of a retention problem. Because at the end of the day, that's what we've been able to do for the past decade. And it's a simpler narrative to embrace than unpacking what I think is like the deep structural and cultural issues that drive people out of care work. And I think sometimes what's missing is a genuine understanding of like who care workers are, like predominantly women, immigrants, women of color, and they're people that are motivated by purpose and not paycheck. And here's the reality. 32% of this population relies on Medicaid. They're 3 times more likely to struggle with anxiety and depression, yet they're more likely to donate than the average American. And when you look at like how this population is driven, it's care, it's connection, it's calling, but they're like misunderstood. And I'm going to share an example with you. I was with the Alliance a couple of years ago on Capitol Hill Day. They invited me out to come talk about the workforce. And I remember having a conversation saying, everybody knows the workforce. Why do you want me to come and talk about the workforce? This is just really well known. And it was fascinating. In the first couple of meetings, I learned that the workforce isn't very well known. A caregiver is not an RN. Nurses are what's understood. It's not actually caregivers that are understood. So, I think, what I found walking out of those meetings is a sea of opportunity. It's people that cared, policymakers that cared, but they didn't really understand what a caregiver was. And so I think there's a lot of competing policies for attention right now. And sometimes it's overlooked because it's messy, it's hard, it's deeply personal. And I think we need to reframe the narrative and to show that, like, investing in retention and wraparound supports for the workforce and the well-being of the workforce isn't just like the right thing to do. It's like smart policy, and it takes education. So really, I think it boils down to, and Dr. Landers, I'd love to get your perspective on this. I think it boils down to education and lack of knowing at a personal level who this population is.
Brandi, thanks so much. And you've been such a leader. Your research has contributed, to better understanding of the workforce. So I think, the issues that you raised about awareness and what do people really know, you've really, contributed to improving, our understanding. And I think, I couldn't agree more with your perspectives of how do we, um, get more people to stay in caring fields, and also we need to attract new entrants as well, because when I look at it from an aging perspective, just societal demographics, the numbers aren't good, whether we're talking about family caregiving or the formal caring workforce. We're seeing an explosion over the next several decades of that 85 plus population, and at the same time basically no real large increases in the younger population. So a larger portion of the population is going to have to go into caring if we're going to have people's needs met, if we're not going to have, unaddressed suffering or people aging in isolation and despair, which are real possibilities. In fact, there are examples today, unfortunately, in our society right now as we speak, where there are people that need services that are on wait lists, or their families can't afford care, but they are at the same time not eligible for public program care. And so it is a real serious issue. I think, you know, making sure that the work is in the work conditions, and the environment is conducive to people sticking around, learning maybe, is I know some of the research you've done has shown that a portion of the population actually are interested in doing this work as part of a journey in health and human services. So, how do we, that they have interest maybe in other credentials, nursing, administration, leadership in the course of their um, career. So how do we support them on that journey and keep them in caring longer and attract others in because of that potential? Certainly, making sure that it's a good, viable job for people, that this is what they want to do. This is their calling. This is what they're good at, irrespective of any sort of journey or advancement is
Yep.
really important as well. Um, and I think another thing I think about, and I don't know if it's been on your radar, is that just because of the demographics and the numbers, we do need healthy, vibrant older people involved in the care of sick and disabled older people. This sort of retirement reimagined, maybe people that had their own personal family caregiving experiences and now are looking for some extra income or meaning in their life. How do we get older, healthy people involved with the care of their maybe less fortunate peers, because the numbers just aren't great?
Yeah, I'm glad you brought that up. Actually, one of the studies that we did, this was really, really encouraging, actually. So we did a data study. It was over 67,000 direct care workers, and it actually surfaced for us that there were 7 different personas of people working in care, and 2 were actually retirees, recent retirees and older retirees, which was really encouraging, actually, to see what it unpacked for us. And we've done a lot of education around this. Is when you look at how the world is messaging today and recruiting today, it's so often focused on people that are just already working in care that identify as a caregiver, a CNA, or a home health aide, but that's not the broader persona base. It's students that do this on the side. It's people that do this for a second job. It's moms. It's retirees. It's broader than that. So I'm glad you brought that up. And as we think about like pipeline expansion, I think that's key. But also, as we talk about, and I humbly think retention is the biggest underutilized growth metric that's going to help us to get to where we need to get. Each of those populations is retained very differently, and what they care about is very different. So I'm really glad that you brought that into the conversation. Happy to share that research.
Yeah, I think let's just keep going down that pathway. I think that's extremely interesting when thinking about retention and how those different messages could work with different audiences. So when it comes to both recruiting and keeping home care workers in the field, like what have you seen work? What is the data telling you? And through your leadership at Mission Care, what role do you see culture playing in fortifying that workforce?
Yeah, that's a lot to unpack. So I'd say first we'll go recruiting. Recruiting can never stop. And I would say when we take a look at the landscape, a lot of the larger providers, they have this like everyday recruitment engine, if you will. Some providers don't have an everyday recruitment engine. It's a little bit more retroactive, if you will. So when we say what's working is you can leave no stone unturned and you can't turn it off. Like you just can't. And at the end of the day, there's not one website, there's not one tool, there's not one technology that's going to get home care agencies every hire that they need. The reality is, and our team has a lot of conversations about this. They're like, ooh, well, I want to, move money from Indeed over here. I want to take money here. I'm getting applicants over here. And you know what we always say? You need them all because we're turning away cases. You have unfilled shifts. So my advice is you need all of them. You need all the tools. You need automation. You need AI. You could do like a whole podcast just on that kind of alone. But I would say, just as much as you're focused on recruitment, you need to focus on retention more. And this is where I think there's a big opportunity, because if we call into a home care agency today, we ask who owns recruitment, easy answer. You ask who owns retention, we all do. We're working on that. We have an app for that. Like no one owns it. I think the world needs to measure net workforce growth, not recruitment. You got to make your team care about net workforce growth.
Yeah, if you're losing more people than you're bringing in, you're not growing. Even if your recruiting is going quote unquote well, it's certainly the math isn't right in that condition.
And that's an easy thing. In an environment where you can't pay more, it's about how you orient your teams from a leadership perspective. And we've seen transformation there. When you take a team and you change their goal, you're like, you're not responsible for that KPI anymore. You're responsible for this one. And we've seen traction there. I'd say the other thing that's like not working when I talk about and think about like retention is short-term rewards and incentivizing home care workers just to like take a shift or show up for work. I think there's a little bit of this like rewards bubble at the moment. And I think throwing dollars and cents at people to show up to work for transactional behaviors is actually really risky. And in theory, it seems like it should work. And in the short term, it can. But in reality, and it kind of goes back to what I was talking about previously about how people are motivated, this workforce, home care workers, have very transactional relationships at work. If you were to ask the direct care worker who their boss is, they're going to tell you it's the recruiter, or they're going to tell you it's the scheduler. Yet they do this job for care connection and calling, and they're completely disconnected at work. This is an opportunity. And so if you think about just like compensating people for transactional behavior, you're not leaning into their why. And that's hard to unravel. And I will share, like, we now are having conversations with companies that are like, how do I unravel these rewards? I can't sustain them. Like the reality is like providers can't just pay more. Like this problem is bigger than what a provider could sometimes do on their own, right? With reimbursement rates, they can't pay more. And so, that's not working. But I would say what I am encouraged by and what is working is, although the world isn't motivated from a long-term perspective by short-term rewards and recognition, they're motivated by community and purpose and being a part of something. And like rewards and recognition can be like bundled into like a broader program. And I'll share, we did an analysis and we looked at hard data, and we did this across 142 organizations that like leverage the Coach Up Care platform and like followed the playbook. So these are organizations that are like building community and leaning into to bring their team together, and they're serving, and they're having fun movement and fitness competitions with their team, and they're engaging them. They're bringing their team together. And I will tell you, by them focusing on like bringing their team together, we have been very, very encouraged that they've been able to increase retention without wage inflation tactics. And our goal was kind of unpack and learn, like, what can you do in an environment where you can't pay more? Because that's the elephant in the room. And I know we're going to talk about that one later, but you can't pay more. And how can you inspire a workforce? I feel, encouraged that we're seeing the needle move. Now, I think there's more we need to do there. We need to figure out ways to support the workforce in a way providers can't, because a lot of these individuals are struggling to like keep their lights on and pay for food and pay for transportation. And we need to also like solve that in parallel. But I would say what's working is connection and connecting people. And it's not just about technology. I think it's a human business. And I think it's about building that community with teams.
Brandi, if I could jump in for 1 second here, and I think there is the elephant in the room, and I don't think we should avoid it, at least having a little bit more of a conversation about the financing and compensation concerns. But I do want to go back to the environment, and one of the critical parts of this environment, in addition to the team and supervision and the company culture, if you will, there's also just the environment in their client's home, in the people that they are caring for, and that interaction with the care recipient and that environment. And is there anything that you're seeing like around, matching, or around, making sure that the clients and the clients' families have been sort of coached on their role and responsibility in all this, that's helping? Or is it really, about that relationship with the employer where you've seen the most focus?
I think we need more education for families. So I've seen some organizations starting to better educate the families, even from a recruitment perspective. Like, here's why you should hire someone that might not look like you, that could really like be a great fit to care for mom and dad. And so I've started to see some movement there. I really think families need more education. I think they need a lot more education. So I think that's absolutely something we need to do. And I also think, just from an employer perspective, it's really important to have your eye on what's happening in the home when like the niece or nephew comes in, or there's a change in the home, or there's new family members that come into the home. Because and this is why it goes back to like, you really have to have a connection, a pulse with your people, because otherwise they'll just leave. And this population is like a bottler, and they might not tell you. And it's incredibly difficult to know what's going on in the home when you're not there on a day-to-day basis. So I haven't seen enough there, I guess, is my answer. I haven't seen enough. And I think it's an area that we all need to focus on. Have you seen anything interesting in that space that people need to know about?
I mean, I've heard about some algorithms of matching, at least based on neighborhood and geography, that the further that the worker lives from a family, it sometimes doesn't work out as well. And so using that as like a matching component. But I've not really, in terms of any other characteristics, like, for example, are some people more comfortable in a self sort of sense of confidence, like around people with dementia, or are there characteristics that match well without, of course, getting into unreasonable areas? But I think that's critical. And I don't know, Elyssa, I know you wanted to make sure we touched on a couple other things.
Well, I do want to go into payment policy, and I think that's the critical conversation too, or the elephant in the room that we already said. But one thing I do think will be helpful, if we can bring it down to the ground floor and make it practical for providers. I think what you said, Brandi, around retention is really resonant. So if I have my chief retention officer hat on and I'm trying to figure out, okay, how do I get started? Like, I know I have this problem, but I don't really know where to do. It's so overwhelming. There's so many places to go. What would be your advice to kind of get started, or what have you seen work well?
Yeah, I think it's the first and foremost, what gets measured gets managed. So it's like you actually need to be able to like measure the metrics that you care about. And I think as a leader, it's like setting the metrics that you're going to hold your team accountable for, in its most basic form. And it's like holding your team accountable for net workforce growth is going to make people focus on retention. By forcing people to focus on retention, they're getting it under the hood and be like, where am I losing people? Most of them are getting lost in the first 90 days. Why do they get lost in the first 90 days? A lot of people don't have someone that owns the first 90 days. You have someone that owns getting a hire to the door, and you have a scheduler that owns shifts, but you don't have someone that owns acclimating that individual in the first 90 days, right? So I think like where it starts is you have to have the right system, tools, technology. You have to have the right operations, and you have to have the right leadership and the right partners. And they all need to work together. And I think you have to be measuring the right things. And that's where I'm excited, because I think that's an interesting opportunity. I think at the end of the day, we have a lot of really hard problems ahead of us. You need providers, payers, policymakers, and the workforce and families all rowing in the same direction. And they're quite frankly not all rowing in the same direction today. So we need everyone rowing in the same direction. So I think where it starts in its most simple form is like, let's orient everyone on the metric that I need you to focus on. And we're starting to see some traction there, which I think is really good. Like one of the key areas when we're working with any company, we orient them, our teams, technology, and their teams around net workforce growth. That's going to help you fill more shifts. That's going to help you deliver more care. And at the end of the day, I'm a big believer in this. Retention's a quality metric. Like you increase retention, you increase star ratings, you increase member satisfaction, you decrease abuse rates. It's the metric that like's talked about, but isn't necessarily managed or managed well. So I think, that's where it starts. I'd love your take and your perspective on that, but I'm so excited and bullish around what we're seeing and focusing there.
Yeah, it's so simple, yet not easy at all. Like you distill it down and it makes so much sense when you bring it back to us like that. But I think you mentioned this while you were talking about getting policymakers and all the different constituencies rowing in the same direction. So what do you think would be those like biggest changes that we can make around policy or legislation that would have the biggest impact? And maybe that dovetails with the earlier conversation we started to have around payment policy.
Oh gosh, not an expert here, and there's a lot to unpack. So, well, there's a few things, I guess. So, I think Medicaid work requirements could be catastrophic if not handled thoughtfully. That one's keeping me up a little bit at night, if I'm going to be honest. Many of these caregivers are Medicaid recipients, and I think new requirements force them out of eligibility or out of the workforce altogether, if not paired with like workaround and wraparound supports. Area we have our eye on, and we need to think about too, like addressing the SDOH needs of the workforce to keep people in care, and that's just fundamentally something like an employer or provider can't afford to do, right? They can't. So I think Medicaid work requirements, we need to look at this. And I actually think there's an opportunity in there. I think there's an opportunity to think about how to approach this, but I think it's going to take a lot of work. But I think we need some policy reform around Medicaid work requirements for the direct care workforce. I think the other is reforming how we pay for care. Like how we pay for care fundamentally like shapes the workforce. And we see a lot of value-based payments out there, which I think are awesome, but a lot of times they're just for the bigger providers. They're not necessarily structured for the smaller providers. And I think value-based payments that are incentivizing around job quality, they're incentivizing around retention, like it's the underpinning of quality. And again, like what you measure gets managed. And so I think that's an interesting area of focus, and aligning reimbursement rates too with the realities of home care. Like many payment structures don't take into account things like travel time, shifts, training, recruitment overhead, and just it makes it harder for these smaller providers to scale. And in so many states, like the smaller providers are kind of like the backbone, if you will, of the delivery. And then if I had to pick one more, and I again could probably do an entire podcast on this one, but I think we got to look around regulations around training, and it is like messy, and it's very, very messy. And I think regulations that are often meant to protect, they often backfire when they're not aligned with the realities of the direct care workforce. So training regulations, they vary wildly by state. Oftentimes, this workforce does not own their own training. Like it's painful. They have to go to an agency, they get their training. The agency has to pay someone to go through the training. It's compensable time. It's expensive for the agency. Then there's turnover. Then that individual doesn't own the training. And then they go to another agency and you have to do the cycle again. And that's bananas to me. Like that does not make sense. So I think like we need some change around recognizing that like home care workers, I guess, aren't a line item, but they're the linchpin. And I think we need to look at this one a little bit more deeply.
Yeah, you know, you touched on a lot of things. So for you build that the policy area wasn't your expertise, Brandi, but you're pretty facile with the whole framing. I think when we look at this recent reconciliation package that Congress passed and the president signed, the quote unquote one big beautiful bill. I certainly hope and believe some aspects will get revisited, in the next year or two as implementation timelines come on, and as we have a midterm election. I think the points you raise about the challenges around the implementation of work requirements and how that's done. It's a big one. I mean, it seems like there may be a tech solution or um, an opportunity maybe in some of that, but at the same time, the workforce, they already are overwhelmed in many respects, and not all of their basic needs are met. And to add this sort of layer of hurdles, if you will, and challenges to, them being able to get their basics for them and their family of health. That's a big worry that really could backfire. And, policy wise, in order for compensation for funding to go up, these are really choices that our states, that our federal government needs to make. There are some opportunities around tax credits, around tax policy that could be more thoughtful, that could put a little more resources into this. I mean, the people that are supporting, I mean, I know the issue is broader and it includes, people working in facilities and in hospitals. But when we're talking about people supporting families and individuals at home, they're contributing to a more efficient system. They're contributing to creating value, and otherwise, it could be if it could be that the person would, go right to the hospital or emergency room, waste tens of thousands of dollars of resources. They might need to be permanently institutionalized at, tens, if not hundreds of thousands of dollars a year. And these workers are creating such value, and how do we get that to inure to them? Like, how do we get the compensation, and opportunities there? I mean, because, there are realities, right? I mean, the price of groceries hasn't been trending down all that much lately, and housing costs are high, and housing availability in many communities is limited. And of course, the health insurance coverage, if Medicaid is pulling back for many of these individuals, is going to be a big issue. And so, we've got to find ways to bring more resources into this. It has to be done in a value creating way, because, just our economy and our federal budgets can't really sustain, overloading, even more on, but we've got to find ways to get more resources here.
Yeah, and I can't share enough how important I think it is that people share data and open up data and share stories as well. And when I just like look at the industry, there's a lot of data in silos. We got 750 some companies that are out there supporting the home care space. You have payers that have data, you have states that have data, you have providers that have data. You have a lot of people that sometimes actually don't want to share that data. And I love our partnership, and I really value it with the Alliance, because I think it's really important to take data and tell stories with the data into policymakers so they understand it. It can't just be a small club of people that are coming in and raising the issues or the challenges. Like, the numbers speak for themselves. They need the stories to understand it on top of it. And that's where, I say I'm not a policy person, but I'm passionate about this workforce. I'm very passionate about, like, when we say change the culture of care, there's a lot that kind of goes into that. Like, we're sending letters ourselves got a meeting with a governor and a senator coming up because I wrote a paper saying how worried I am about these things. We got a meeting, and it's because we're sharing data. And I'll tell you, it's hard sometimes. We struggle with getting data from some companies in the space. That's their data. They own the data. They can't share the data. The data's in silos. And I think that's fuck. And I think at the end of the day, like, we just need to think about, if we want to move the needle, we got to move the needle really fast, and we all need to partner. We need to build bridges. We need to come together, and we need to share data. So I'm sorry, that's my soapbox. So not policy, but I really care about this population.
Yeah, absolutely. I think your passion definitely comes through and it gets me excited about it too. And I couldn't agree more with bringing the data and the storytelling together. I think that's our biggest imperative and our biggest challenge as an industry and a community. I think you've left us with so many actionable takeaways. It's exciting to think about where to go next. But if there's anything else that you want viewers to take away, and I'm specifically thinking about like our providers listening who can turn back to their teams and start to make change. Is there anything you would want them to take away and act on now, whether it's from the culture level or the policy level or anything in between?
Yeah, I'd like to just end with kind of like culture and what I mean by culture and what we mean by like changing the culture of care, because I think that's something in there that can like unify all of us to drive change. But when we think about workforce transformation, it doesn't start with technology. There's not a silver bullet. Sometimes it doesn't even start with strategy. I think it fundamentally starts with like how people genuinely feel inside the system. And I think our entire care ecosystem right now is strained, and it's human-centered work, but it's often treated like this transactional business. And we've seen like through our work that when you begin to shift culture at the frontline like level, the needle moves, retention improves, engagement rises, the people feel seen. But it's deeper than just an employee-employer relationship. And Dr. Landers, you kind of like hit on this a little bit, but we need to think about workforce and culture reimagined, if you will, like every level. I think it's about providers and payers. I think it's about states and payers. I think it's about workforce stakeholders and data holders. I think we need to build more trust, more alignment, more transparency. And I think that data piece is like key. So, as you think about like workforce, I think it's about bringing people in. I think it's about bringing partners together. I think it's about bringing your workforce in. Like, I don't think it's what EMR you're on or what training tool you use or what technology you use. I think it's about thinking differently of how to approach the workforce.
Yeah. I'm so thankful for your message, Brandi, that, this this work, it offers so much opportunity for meaning, for a life and work filled with love and purpose and in community. And the these are human relationships. We're really in the business of people caring for people. And and when it gets overly transactional and that's lost, then people disconnect, and they're the very resource that is needed to address the problems and challenges we face. And so I think that I can't say I know exactly how to do it, and the what's the exact recipe for moving toward a culture that is not transactional. It's about meaning. It's about healing relationships. It's about human value and humanism, and showing people they're valued and cared for, on all sides of the relationship. It's critically important, and we're just thankful you're doing this work, and we hope we get to talk to you a few more times, because you gave us about I think a half a dozen extra ideas for topics we could dive into.
Well, I appreciate having the opportunity to be here today. And I don't come bearing the answers either, Dr. Landers. And I think that's where the opportunity is. We need to put a lot of smart people in the room that think differently and hash it out. So appreciate the opportunity to be here.
This show is brought to you by the National Alliance for Care at Home, because every person deserves access to high-quality care where they feel safest, at home. The Alliance is working to advance policies, support caregivers, and shape the future of home-based care. Visit allianceforcareathome.org to learn how we're driving change and how you can get involved. All right, let's get back to the show. We've talked a lot about policies and workforce shortages and all of the issues that we're facing, but I think it's important that we also take a moment to think about the stories, my favorite thing to talk about. And there are far too many stories that come to mind, I'm sure, for both of us. But one that really stands out to me from in the field with a hospice provider was, the hospice interdisciplinary care team includes the hospice aide. And the hospice aide is so close with someone in such a vulnerable time in their lives. I mean, that's a critically important role that they play. And I've seen lots of great care. But there was this one particular patient that I'm thinking of who was a veteran and certainly suffering from some sort of post-traumatic stress disorder that made it very difficult for him to speak at all, but certainly to share his stories. And his wife had shared that with us. She really hadn't even heard of any of his wartime service. But it is the aide who cared for him day after day in, again, some of those really vulnerable moments that was ultimately able, without even really asking, to get him to open up to her and share about his story and the traumatic experiences that he had lived through. And he was brought so much relief from finally getting to let that out. He then started sharing with his wife. We even did a video segment of him sharing his story because he wanted to document it for his, future grandchildren to see. So just one small continued act of kindness by this home care aide completely transformed not only his, this patient's wife's perspective on his end of life, but brought him immense emotional relief and psychosocial relief at the end of life. And again, that's something so unique to this position, and why we cannot lose that special touch in home health aides.
Elyssa, that's an incredible story. Just the healing that happened there, and the imagine not just what that means for the patient that got that care from the aide and his ability to get that relief, also for the family and for his legacy, and it just has such incredible implications. It's aides, it's like great medicine, right? The work that home health aides are doing is often like curing medical problems, right? We think about, like, listen, I'm going to tell you guys something, like a personal secret here, okay? I'm one of those people, I cannot stop eating pizza and ice cream and chips. Like, I can eat any. And so I've been starting to impact my blood sugar and stuff. And so now I've been taking these injections, like that help me, these mega drugs or wonder drugs. And you know what? It's like a couple $1,000 a month or something like that. And it's so valued. Like, we have such value on these like biomedical interventions, which are great, by the way, because otherwise I'd be like stuck here, but couldn't even move. But the whole thing is the humanism, the tender, loving care, the support and compassion of an aide creates so much value, often way, way more value than any of these drugs or devices or treatments or hospitals or doctors or any of that stuff. And yet sometimes it feels like we don't care enough about what they do, that they're not recognized enough or celebrated or compensated. We've got to get better at this, because I mean that story just hits it home, right? That we're talking about curing illness in many respects here. This is serious business.
Home health aides are the backbone of our healthcare system, providing essential hands-on care that keeps millions of people safe at home. But despite their impact, they're often overlooked. If you believe in better support, recognition, and solutions for this vital workforce, stay informed by following our podcast. Just search for Who Cares on Spotify, rate us, drop a comment, and never miss an episode. You'll hear expert insights, real stories, and the latest on how we can strengthen the future of care at home together.
Better care starts with better support for caregivers. Investing in home health aides means investing in the future of aging in America. Care at home will impact us all. Let's shape the future together.